HIMSS13 TV, and I'm here with Dr. Casey Poon, medical informaticist at 3M. Thank you for joining us today.
Thank you for having me.
So first question for you, why is achieving system interoperability such a challenge for hospitals and health systems?
Well, a lot of hospitals and health systems have different information systems that they've acquired through the years, or they're still acquiring hospitals and health information systems or facilities. And trying to get these disparate systems and disparate facilities to share information and to exchange information is very difficult because these systems were created by different people, by different vendors. They're using different codes to represent their information. And when one system tries to send information to another, the receiving system is not going to understand what the sending system is sending.
Many organizations are looking to a single vendor approach. Would this solve the problem?
It solves some problems, but that approach is not insignificant. It's a very time and resource intensive process. It's very expensive. It can solve some problems, but you still have the ongoing problem of, for example, a given health system acquiring new health systems or acquiring new information systems. So this issue of interoperability is going to keep popping up. And that approach, a single vendor approach, again, is very time and resource intensive. And the debate between leveraging existing systems and having them integrated as opposed to a monolithic approach has recently cropped up in the news again, and it's being even debated by the federal government. So, for example, the Department of Defense and the VA had initially decided to go a single vendor approach, but now they're reconsidering that. So they're reconsidering whether it's going to be worth the time and expense to do a single vendor approach, again, as opposed to simply integrating their disparate systems. And integrating systems by, for example, mapping, which again is the approach that we take, it takes less time and it's less expensive than actually ripping out all your existing systems and replacing them with a single monolithic system. So it's an option that can be considered by people who don't necessarily, or organizations who don't necessarily have the resources to go the single vendor approach.
Now, from your perspective, what can healthcare organizations do now to address interoperability issues?
Well, it's a matter of getting them to speak the same language, as it were. It's a matter of them using the same codes or being able to translate from one code to another. So they have to find a way to all either use the same set of codes or to be able to translate between the codes that they are currently using to ones that they want to be understood by receiving systems.
Now, can mapping help meaningful use requirements?
What we do at 3M is mapping. That's one solution, and that's the philosophy that we take. We actually have our customers map their local codes to a centralized place, which we call the Healthcare Data Dictionary, and we're essentially translating their codes to a common code set at 3M, and all the systems that are mapped to the Healthcare Data Dictionary are interoperable and can communicate with other systems that are mapped to the Healthcare Data Dictionary. So it's a way for them to achieve this interoperability and this ability to translate codes without necessarily requiring them to exchange or rip out the systems that they've already invested in. So they can still leverage the IT investment that they've made, and yet they can comply with the standards requirements and the interoperability requirements that are being adopted by the federal government, for example, and even independently by health systems who want to increase the quality and the safety of their care.
Now, why is a common language for healthcare crucial for safe care delivery?
It allows clinicians and practitioners to be able to have all the clinical information that they need at the point of care when they're taking care of a patient. So complete information is important for quality and safety and efficiency of care. So the interoperability and mapping and information exchange tries to accomplish that tries to basically have all the patient information by the clinician.
Thank you, Casey. And I'm Erin McCann for HIMSS13 TV.